laminectomy, and as you see here, quite significant stenosis, and as well there's a synovial cyst here. If you go there, this is a myelogram, and you see the spinal cord. We are coming actually down, and here you see some facet disease in multiple levels, but if you come down here to the thoracolumbar junction, there's a large facet cyst and disc disease and causing compression. Patient has symptom corresponding to this level, as well as you see here, when we come down, there's significant stenosis in multiple level. Here this contrast is completely gone, and degenerative disc disease, and as well patient has a spondylolisthesis. As you see, the back of the bone is falling backward. In the coronal as well, there is some scoliosis. And here we did a 4-level OLLIF procedure, meaning we put a cage inside of the discs between T12 and L4 and lift them up and literally internally braced it. So 4-level fusion, 10 surgeries, 2 rods. This is a big surgery. The surgery, we did it actually in less than 80 minutes. I believe it was 79 minutes for us to do the surgery. And these are the pictures of the surgery actually, which we are orienting ourselves first. And you see the large osteophytic changes, but the growth there is not really adequate. So we put a K-wire, put Jamshidi, take the bone marrow. Then we enter the disc here in this obviously the AP view. In the lateral view, as you see here, again we put the Jamshidi, then take the bone marrow, put the K-wire in, then we enter the disc. This was really difficult because of the large osteophyte to get in, but we are able to do it. And here you see that now that when the dilator goes in, it really opens up this space. And in the same fashion, we are moving forward to the discectomy and then put the cage in. Here, all minimal invasively done, and the first cage is in. Then we readjust, or we put the screws or the K-wires in the L3 and L4. Then we move on to the other levels. And here we again you see the putting the K-wires. Now we are adjusted for the next level. We put again do the discectomy in the 2-3 disc. And here in the lateral view, you see when we enter again, you see that we are opening up the space. Actually, there's a good picture as well that once we did the discectomy in the first place, you see that distance between the osteophyte. That is because the space is open now. The osteophytes are separated. Now, here in the same fashion, we put the cage in here the lateral view, and then we put the Jamshidi in the level above in the L2, and then we concentrate on the upper 2 levels, where we again the same way we put the after we put the K-wire, we put the dilator, we use a drill, very specialized tools, and then we put the cage in again here, and then dilate the space. Now here we practically repeat this process for T12 L1. And then after this, doing the discectomy, we put the cage in. It's a little, the angle was a little difficult here, but we are still able to do that. For some reason now it's not advancing, but the end result was actually this. As you see here, I'm just going to jump to the end result. Obviously, we put the screws individually and then pass a rod. And this is the end result. This patient had very severe pain, claudication, and I just took a testimonial that I will put them all together for view. And here it's locked, and that's the end result. I would like to ask you permission to use this video for educational purpose and on internet.
You're going to record it there?
Yes, I'm recording it
very
already.
good.
Yeah. Do I have your permission?
Yes, you have my
Excellent.
permission without a question of a doubt.
Okay. Tell me about your before our surgery, which was yesterday. Tell me about your pain and your symptoms.
I suffered with this for 2 years.
Mm-hmm.
It didn't go away. I put up with it.
Mm-hmm.
I had two previous surgeries on it.
And I may add to that your previous surgeries were decompression, meaning we took the bone off. By taking the bone off, we actually made the spine more unstable, but we didn't fuse your spine. I mean we spine surgeons, because I didn't do the surgery.
Okay. Then maybe with the way that I feel about it, I've got a toy shed at home. I call it a toy shed.
Okay.
It's about, maybe 200 feet from the house.
Okay.
Many times I couldn't make it without stopping 2-3 times.
We call that claudication. What you just described, we call that spinal claudication.
Okay. And it was set in right from this belt line.
Mm-hmm.
So I had to either get down on my knees or
How bad was the pain?
I didn't go any further. I couldn't go any further.
Yeah. No, yes, and you have pain in the back and the legs?
Okay, the pain started down on my right leg, and it exaggerated to the left, and went down my legs, then jumped over the knee.
How is the leg pain now, since the surgery? How is the leg pain?
I'm laying here doing nothing, I have to say it the way it is, and it isn't bad.
It's not bad.
It's not bad.
Do you have any pain in the legs at all right now?
I would say a 2 or 3.
Okay, not bad.
No, I can live with it.
But you have walked since the surgery, right?
Yeah, I got up for the bathroom.
This is just the surgery. We finished it yesterday afternoon.
Very short time,
Yeah.
time element in there that I could get up and do it.
Yeah.
The toughest thing was turning. But
Twisting,
if I could lay straight forward, it isn't bad, Doc.
Yeah, and you did not get a small surgery. You got one of the biggest surgery anybody can get into a spine. We replaced 4 of the discs. So first of all, you had what we call post-laminectomy syndrome, meaning that your spine got even more unstable after we spine surgeon took your bones off, and it was bending to the side with some scoliosis, and we took 4 of the disc out, put spacers in, and put actually 10 screws and 2 big rods in your back. So that was one of the biggest surgery anybody can get. And you're just sitting, laying down there and smiling and got out of bed already. This is pretty darn good, actually, after this big
If this thing keeps going the way it is when we speak now, I'll come back and shake your hand.
Yeah, we'll get there.
No, but that's it's been such an issue with me because I couldn't do. I mean, I have lots of things I want to do.
Yeah.
And if it goes as good as we speak right now, I'll be able to do a big percentage of them.
Yeah, no, and may I ask how old you are?
86.
86. My colleagues, for a good reason, and really justifiably, they say never, ever do this kind of big surgery on somebody your age, because the surgery that we did for you took us less than 1.5 hours. In 1.5 hours, we did everything we talked about. To replace 4 discs, put 10 screws and everything. This surgery cannot be done open fashion way in 1.5 hours. It's a 10-hour surgery, and people behave very much differently after an 8-10 hour surgery than after a 1.5 hour surgery.
Yeah, I was very skeptical.
Yeah, and you should be
going into this thing.
Yeah.
Because doing it twice before, knowing what I came out of.
Yeah. Do you remember the other surgeries where they just opened up the space? They didn't even put any disc replacement or cages and so on, or fusion. Do you remember them?
The second one, which was done in Virginia, out east, not Virginia, Minnesota, out east, they went in and they bored out around the nerves to give it more room.
Yeah, we call it decompression or laminectomy. That's
whatever you call it.
Yeah. How did you feel after that surgery?
It was more skeptical then I feel this is more complete
Yeah.
than anything I've ever done on my back.
Yeah, and it is. The job is done.
Yeah,
I will put the pictures of your back online so everybody can look at it.
Okay.
And even you'll describe it. I will describe it. But you got a very big surgery. But I was very satisfied with the end results. Okay.
You were. With that being said, can I get a copy of what you're...
Absolutely. I put it online. So you can go
okay.
and watch it with your family.
That's why I feel so good about it, because I got a lot of grandkids,
Yeah.
and I got a lot of things I want to do yet.
Good, and you will be, okay?
Yeah.
I'm looking forward. Now, still, after this kind of big surgery, certain activity has to be limited, you
Oh,
cannot
yeah.
go, the bungee jumping and things like that, but we'll get where you need to be, okay?
I will. So,
Okay, thank you so much, I appreciate
I
that.
appreciate